Hey everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm joined by Ian Koons, the co founder and CEO at Karoo Health. Ian, how are you
Hey,
today?
good. Thanks for having me, Jared.
It's great to have you. You're one of the probably few people that I actually go pretty way back. I've known you for several years now. I feel like we've been talking for several years. And first time having you on the podcast though, so I'm excited.
No, I appreciate it. I think the first time you and I met, I think your company was a staffing firm or close. It has evolved over time for sure.
Yeah. We were talking about some areas of staffing, and we don't do that at all today. So it's hey, that's what you have to do, right? As a startup, you have to also find the right opportunities to pivot. Ideally, you never have to pivot, but it's not a bad thing to pivot. But excited to have known you over the last couple years and to finally have you on the podcast. I remember when you were talking about getting this new company rolling a while back, and you wanted to come on at the right time. So I'm excited to have you here today. For those that maybe don't know you, Ian, can you give them a quick snapshot of your background, and then we'll talk more about Karoo Health?
Yeah, I mean, my background seemingly, grew up in healthcare, son of a physician, so couldn't kind of get away from it, and then really, started my career, within healthcare and started a healthcare staffing consulting firm, really regionally based within the Mid Atlantic. So we would staff, all the big health systems, Privia when they first kind of got started, and then moved on to kind of an OB roll up where was in a variety of roles there, and then most recently was kind of the head of growth and M&A for Ovation Fertility. So Ovation, kind of a throwback to the '90s, where physicians actually ran their practices, but in this case, they'd have a surgery center like that they would kind of profit off of, and so we would, as Ovation, we would kind of carve out that IVF lab, and so I was in charge of all kind of health, kind of M&A for Ovation.
I didn't know about the Privia Health piece. We actually had their CEO Sean Morris on before they ended up going public. I think it was maybe a year and a half ago. It may have been even 2 years. And then someone picked up that podcast, Ian, and put it in the Seeking Alpha buy side like analysis. But we it wasn't like we were just telling people what they did. But I guess that took the description piece, right? Of like, what does this company do? And I think the same thing. It's pretty cool when that happens, but I did not know that. That's really cool. I did know about the Ovation fertility piece, obviously, and what you're doing over there. So it's cool to see everything come full circle. Now you have this company. Can
Yeah,
you
and I
talk
mean
us
we
through now? Oh, sorry.
yeah we was at Ovation, a great company backed by Morgan Stanley Capital Partners. Can't speak kind of more highly of the team, and then connected with a good friend of mine, Chad Moore. Chad has was is the co-founder of Eligo Health Research. And so him and I had connected, just similar how you and I have connected over the years in terms of what's going on in healthcare. And he shared with me that he had some personal reasons in terms of exposure to cardiovascular disease within his family, and then it really struck a chord with me. So my best friend had a heart attack and passed away at 29. So kind of personal for me. So when Chad brought that up, it was, I don't want to say fate, but something that really piqued my interest in wanting to make an impact. And so it really led us down this path the last, 8, 9 months of doing a deep dive on the clinical delivery models and the current state of cardiovascular care in America. And we got connected to, via research to Mark McClellan, the old CMS administrator, who was commissioned by the American Heart Association, basically to say, why are outcomes, getting worse, and costs going up? And ultimately, the result of that article and publication and research was, there's not an integrated delivery model. The misaligned incentives within the providers themselves, and then ultimately the value. There's no value based care, and so what we bring is hopefully that integrated delivery model, like Karoo is, bringing those digital assets. and experience, and wrapping them with, kind of a supported journey. So, what we found is we talked to, I don't know, probably 100 cardiologists around the country, and we said, if you had unlimited time and resources, like, how would you build it? And this is the result of what Karoo is. And so, it's a model where in the current state of cardiovascular care, you have these patients that have been waiting for a month, 2 months to be seen. They're high risk, have cardiovascular disease, and they are seen for 3 to 4 minutes, right? And in that 3 to 4 minutes, the physician has to do medication management, nutrition. They may be on 5, 10 different medications, and everybody situation, and then they say, work out, be healthy, come back in 6 months. And that's normally when kind of an event happens, and that cost driver happens. And so really what Karoo is having this integrated system within kind of building micro clinics. So imagine, instead of 3 minutes and you've been waiting and anxious, and coming in and having that consultative approach by a cardiologist that's not motivated just to see you for 3 minutes and on to the next, but sit down and go over the medication, the nutrition, and then from there develop a comprehensive care plan. And what that entails is really the integrated team. So that's they're based upon the severity of their disease state. They're introduced to their care team, and that includes a nutritionist, a health coach, a technology, and the wearables as well, right? And so wrapping them with that in a supported delivery model, we believe that we can greatly reduce not only the admissions, but the unnecessary testing that goes along with it, in the current kind of state of cardiovascular care.
And Ian, you recently announced, or within the last couple weeks, that you raised your first round of funding. Can you talk us through that funding and who participated, and maybe some of the areas you'll be focusing the use of proceeds towards?
Yeah, so I mean, I think so. In terms of, we went through a pretty comprehensive, kind of evaluation process of going through, who would be a great partners, and two really stood out to us. One, is Panoramic Ventures, which is out of Atlanta, and Austin, and the team have been fantastic thus far. And so, Panoramic, we were fortunate to lead the round, and then First Mile Ventures, Aaron out in Denver as well, participated. And then we had a host of kind of healthcare executives. Many of them have been on your show. Was also angel investing in the round. In terms of proceeds, right? It's really, for us, we're in negotiations with 5 plus payers around the country that are innovative, and have a focus on their members within cardiovascular care. And so really the proceeds, around developing that team and then furthering those conversations to pick that first geographical market, that will ultimately, first or second geographical market that will ultimately open, in kind of Q1 of 2023.
Interesting, and that'll be here before you know it. It's crazy to think we already made it past Q1 of 2022, and yeah, it's wild. Time's just flying by. In this, I feel like time went by. I don't know about for you, but for me, like during the pandemic, it went by